Just when it seemed like the end of the pandemic was within view, a sharp turn. A new variant spreading like wildfire, the return of partial lockdowns, school closures, and separation from loved ones. It's a harsh blow to the pandemic weary, but as we enter a third calendar year of COVID-19, just how much damage is this latest wave inflicting on our mental health? What are you seeing in your own practice?
Many of the patients I've spoken to do feel stressed. Their individual circumstances may vary. Working in the hospitality industry, trying to arrange childcare while working a job.
Psychiatrist Dr. David Greatzer says many feel let down being back in what seems like a bad deja vu. But when it comes to more severe mental health implications, he says there are segments of the population who are at greater risk.
I think most people are going to be okay, which isn't to say that they're not going to feel stressed, but they have a resilience. We worry very much about populations within our larger population. So people with a history of mental health problems, people who've survived COVID. These individuals probably are having a tougher time. There is an increase in alcohol sales and evidence of alcohol misuse. People with eating disorders are more likely to be admitted to hospitals.
The Centre for Addiction and Mental Health has been tracking Canadians' mental health since the start of the pandemic. The most recent data is from July 2021, when the pandemic picture was drastically different. Reports of anxiety, depression, and heavy drinking remained relatively unchanged from the previous summer, and reports of loneliness actually went down from 23% in the summer of 2020 to about 19% in the summer of 2021. The data for this January has yet to be completed, and CAMH senior scientist Dr. Haley Hamilton says it is still too early to say how much of an impact Omicron has had.
It's always interesting to see the data because it's often unpredictable. It doesn't always, turn out to be what we expect. But again, based on previous waves and what we've seen over the last almost 2 years of the pandemic, it would not be surprising if there are, again, increases in several aspects of mental health and well-being.
Experts are urging governments to continue to invest more in mental health services, which are already stretched thin, warning that the mental health impacts of COVID may long outlive the physical burden. But researchers also hope the data will show Canadians that if you feel your mental health is suffering, you are definitely not alone.
It's important to remember that help is available even though there's a pandemic, and that these sorts of conditions are highly treatable. So please reach out and get help if you think you need help.
For a link to resources, you can head to our website, citynews.ca/extras. For City News, I'm Erica Natividad.